Hi, Dr. Philip Yu at the 21st Century Laser Stem Regenerative Medicine Institute. This is our medical director, Dr. Renato Landero, American College of Physicians, FACP, 50 years internal medicine, pulmonologist, and geriatric specialist. Here's the world's best registered nurse anesthesiologist. Today we are doing umbilical cord stem cell grafting with laser guidance on Molly's bone-on-bone medial knees. You can see she has a genu varus causing a bow leg. She just happens to have more pain on the medial joint because of that and more inflammation. So we're going to graft the cells medially, bilaterally, and to make it more effective and comfortable for the patient, we're going to do it under knee decompression. As you can see, this traction device has an obtuse angle, which is going to open up that medial joint, making the cells go in the joint because it creates a vacuum. It'll also make the needle go in like butter because there's less resistance because we are opening up that joint. I'm going to make this cable line actually more parallel, and that way we get a more even line of pull. We have 30 pounds of pressure, which is enough. You feel that gentle pull there, Molly? Is that comfortable?
Yeah, I'm fine.
Okay, great. I do want the knees a little more of an angle. I'm going to pull this up for you.
Okay.
Okay. Yeah, I like the knees a little bit more. It just opens up the joint a little better.
Okay.
I'm going to go ahead and mark the target tissue with laser guidance. We already know what's at the medial knee. It's going to make it easy. I'd have to decide if we're going to graft them superiorly, inferiorly. We let the infrared thermometer decide. We're going to put it in the point of greatest inflammation. We have 78.6 up here, 78.8. Right there, 79.4.
It's true.
79.9. Right here. Here's our target tissue. Go ahead and mark that. And that's probably tender, isn't that? Yep. 9 times out of 10, where you have the greatest degeneration in the joint, that's where we're going to have the most pain. Right there. Okay, so we have our point for the right knee, the left knee. Go ahead and mark that area. Superior medial, 78.7. Inferior goes up to 80.7. Right there, 81.3. That's area greatest inflammation. Tender here?
Yes.
Yeah, yep, right there. You can see that I like to use the round tip of the pen, so we make sure that we have a nice divot that goes right in the capsule with the least amount of resistance. So we're going to go with inferior superior approach, about 45-degree angle towards the plane of the tissue plane. So Michelle, I'm going to show you our approach here. So this one, about 45 degrees, just like that. When you feel that divot right there, feel that nice point. Yeah, and then this side, same thing, 45, inferior to superior. Just see that crease? That's where we want to put it. It's going to fall right in there. Okay. And we're going to support that with cryo spray. This will help numb the area. We don't like to use lidocaine. Might be allergic reaction, might damage the cells. So we have 2 cc's of allograft and 2 cc's of sodium bicarbonate to make an alkaline environment to make the cells proliferate. We'll start with the left knee. We'll go ahead and graft the left medial knee joint. Go ahead and numb the area.
Beautiful.
put 2 cc's of allograft in this side.
That's 0.5 or
Hey Ben, could you give me a set of grafting tools I'll wipe down with the wax? You go ahead and work on her knee when that's done. Hey Doc, you want to do the honors?
Oh, that's so smooth.
Right there. And I'm going to go ahead and disengage this so we could decompress the right knee. And so here, I'll just take the tool for you. So after we graft the cells, we like to spread the fluid around along the target tissue so you don't get that fluid pressure in the capsule. We only want to spread it in the target tissue, which is the medial knee joint. This also creates local inflammation, which we want because that'll activate the stem cells and the cytokine signaling, paracrine signaling, so the cells will stay in the target tissue, which is the medial knee joint. As you can see, it's getting a little red. We're getting blood flow in there. It's going to activate platelets, your dormant stem cells to go support the umbilical cord stem cells to regenerate, repair, and replicate that tissue. Okay. The allograft was defrosted in the light stem panel. After we do that procedure, we do put the light stem panel on the knee to keep it warm and to photobiomodulate those cells. Hey Ben? Yes? Could you get a light stem panel lighted up and on her left knee somehow, please? All right, Molly, you're going to go skiing on the right knee too, okay?
Oh, yes. I can hardly wait. I'll do the water skiing.
There you
first.
go.
As long as I can go in water, I'll be fine.
So how many, Molly, how many mosquito bites did that feel like when that went in your knee, if at all?
It didn't feel...
Not even one mosquito bite?
No.
So, folks, have you seen? That's how we make it very comfortable for the patient, because we're decompressing and tractioning that knee joint out. The needle goes in a lot more smoothly, plus with the cryo spray to numb the area. And we're going to go ahead and decompress this knee. We're going to pull this out.
Yeah, I was surprised because when I have the injections, he hit the bone 4 or 5 times. Well, he tried to find it first.
Was that cortisone they put in there?
No, not the cortisone. It was the other.
The Synvisc, the hyaluronic, synthetic hyaluronic
And
acid.
it was like, well, the nurse says, Doc, you need to look at her face. 'cause
Well, you know why? Is because they don't do it under decompression. So the needle's probably hitting the bone, it's bone on bone. They're not doing the laser guidance. They're not checking to see if the tissue plane is correct. We'll go ahead and graft these cells. Same angle of approach. Inferior to superior.
the laser actually points to the maximum area of inflammation. So they detect it right away.
Yeah. See, it went in like
Which
butter.
makes it a lot easier.
Yeah.
Oh, wow. This is wonderful.
Doc, he does the most important job. This is the dressing room, right?
Oh, great.
Yeah.
I only want the best.
Yeah.
They're here.
Look at that. How many mosquito bites there?
None.
Yeah.
None.
So
Don't procrastinate. Get it done.
Bloodless mosquito procedure. Rarely do they get a drop of blood. Rarely will it hurt more than a mosquito bite going. In your case, no mosquitoes, okay?
Yeah, I don't have Band-Aids like the other procedure.
All right, so yeah, so what I'm going to do is I'm going to go ahead and activate the cells on this side with the myofascial release tools,
Oh, this is systemic.
breaking up the adhesions, causing cytokine or paracrine signaling for your dormant stem cells to go there and repair. After we break down the dysfunctional tissue, blocking your circulation and nerve impulses, we'll have normal tissue planes, paventing, rolling for healthy tissue. The umbilical cord stem cells have two types of stem cells. One is called hemopoietic, which means it's going to form new blood vessels, which means more good circulation because the knee has a poor blood supply because it's an avascular structure. That's why the meniscuses don't heal very well. So anytime you can get those blood vessels revascularized, you need more circulation, you deliver nutrients so the cartilage can heal. It also has mesenchymal stem cells. That's what has like hyaluronic acid, collagen, elastin, all the basic building blocks to regenerate the cartilage there. That bone and bone space. So after we activate those cells, put the light stem panel on both knees. So this is the same panel we use to defrost your cells. Again, it makes a homing signal so those cells stay in their target tissue, which is the medial knees. It also causes photobiomodulation, which basically means it's going to help repair, regenerate the tissue, and replicate the cells so they continue to regenerate and proliferate. So I'm going to let that cook for about half an hour. Then we're going to give you a home unit. It's not as big as this, but it's portable. It has the same diodes, and that's going to help. You can do a half hour a day. That's going to help the stem cells continue to replicate. So it's more long term. I'm not going to say a pot of plants without telling you to put it in the sun. The plants want that ATP energy. That's why the stems go towards the sun. The stem cells are going to go and to get that ATP energy so they continue to divide.
Great.
So that's how we do it. Another perfect procedure. All right.
Thank you so much, Doc.
That's perfect.